All right. Thank you for joining us, everybody. I'm gonna kick this off and let you know that the session is being recorded so that those who are unable to attend live will have an opportunity to review it. Or if you attend and then next week or the next few weeks decide you wanted to rehash this wonderful training, you can go pull it up and watch it at your leisure. And then we also wanted to let you know that we're going to be sharing the materials that Sophie's presenting here, along with some other materials that our team, along with Christy's team at ETSD, have been putting together. So that will all be emailed out at the conclusion of this 2-week training extravaganza that we're on right now. So that should be sometime early next week. I also wanted to do a quick check-in. You should have all received an email from either myself or Sophie at some point that gave you login information and sent you also a quick 5-minute video. If you did not get that and have not watched that video, could you just maybe raise your hand real quick and let us know just so we can kind of gauge where everybody's at? All right. So if you did not receive the email, I see there's a few here. If you did not receive the email with your login in the chat, can you please drop in your name, your email, and what role you have on your team? And then between myself and Christy, we will make sure to get that going. Oh, the video link didn't work for you. Okay,
I've
interesting.
heard that from several treatment folks. I don't know if there was
Okay,
like a blocking firewall thing that went on for certain
that
people.
might be. Okay. Okay. So yeah, if you drop your name, your email, and your role, we will work on making sure that you have a username in the system. And then also wanted to let you know that, let's see, we will be dropping a few QR codes in the chat. The first QR code will be if you have any questions that come up that we don't answer or that maybe you don't want to ask in the main group or you think of later, please drop those in that QR code into the form that we've created there. And we are going to be building an FAQ page out of that information. And then if there's specific questions that we need to get back to you on, we will do that for sure. It'll also help if we need to do some additional training webinars in the future. We could kind of use that information to help guide that. There will also be a QR code at the end for a survey just on this session itself to give us some feedback on how it went for you and if you have any thoughts or suggestions. And then I'm going to go ahead and introduce myself. My name is Joe Vigil. I am a treatment court analyst with OJD at the Office of the State Court Administrator. I have supported SCMS for the last few years, and then now we'll be transitioning to support TCMS, the Reconnect product that Sophie will be training us on today. I'm going to kick it over to Christy.
Good afternoon. My name is Christy Combs, and I'm an analyst with the Enterprise Technology Services Division at the Oregon Judicial Department, and excited to be here, helping you get into Reconnect. And I'll send it over to Sophie.
Hi, everyone. I'm Sophie Vayu. I am the Director of Customer Success at Reconnect. I will be leading the training today and helping to support this rollout in Oregon moving forward. We ready to jump in, Joe?
I think go ahead, go for it. Thanks,
Okay.
Sophie.
So just to sort of set expectations for this training, this is meant to be an interactive training. So you're going to see me present a slide deck. You're going to see me walking through how to do different activities within the TCMS system. And the idea is that you can be following along in your demo account that's been created for you. So those of you who raised your hands and did not receive that login information, Joe, will you guys be able to send that right kind of at the beginning of the call? Okay, great.
Yep.
So the hope is that you can get logged in and be following along during this 2-hour training. And everyone has, of course, a staff login into our training site, but they all should have a dummy participant who's been assigned to them. And for the folks that raised their hand, Joe and Christy, if you guys can just assign any test client to them, it doesn't have to be like a unique one. You can use one of mine if you want, just add them as a case manager. So the goal is that everyone has a client that they can then interact with in the TCMS system so that you're able to document contacts, log notes, log test results, and do all those things that you would do for actual participants inside of Reconnect during the training today. Move you all over here and just get my first slide pulled up. be on now. So this is what we're going to be covering in today's session. Sorry, this is the wrong slide deck, but it's the same agenda, so I'll keep it up anyway. We're going to be talking about how to log contacts with participants. We're going to be talking about how to log general notes with participants, how to document behavioral responses, so specifically service adjustments and where to locate incentives and sanctions that have been applied to your clients. We'll talk about logging UA results, both with the Redwood integration for those of you who utilize Redwood, as well as manually for those of you who don't. We'll go over how to document sobriety in Reconnect, key profile fields that you would need to update. So MAT data, screening, assessment results, things like that in the system. I'll be giving an overview of our treatment plan structure in Reconnect. Joe, correct me if I'm wrong, but I believe that's going to be an optional feature for treatment providers to utilize, although it's something that we definitely encourage be used in the system in some way.
Yes, for sure.
Okay. And then we'll go over how to run the staffing report, and I'll give you an overview of our participant mobile app Reconnect community and the features that are available in that. And we'll talk about how to utilize the communication and messaging features of Reconnect. So since a few of you did not have the ability to watch that introductory video, I will just take a couple of minutes to give you the basic lay of the land of Reconnect. So when you get logged into Reconnect, you'll be brought to our dashboard, which is this speedometer icon in the upper left is how you kind of navigate to the dashboard, but that's the page that you're going to see when you log into the system. A quick note that if you support participants in multiple courts, you're going to toggle between those courts by clicking your initials in the upper right and clicking switch account. So when you're in your actual Reconnect environment, you'll see whichever court that you're in listed in the upper left of the site. And to toggle over to a different court, you're going to click that switch account icon there. But right now, you'll only have access to one court. On the dashboard is a set of tables related to different activity and like data within the TCMS system. So I'm not going to spend a ton of time going through those because we'll kind of touch on them organically throughout the system or throughout the session today. One thing I do want to point out is that on the dashboard, as well as in different parts of Reconnect, you'll notice this little plus sign. That's called a quick action, and it's designed to be clicked on so that you can launch different features and capabilities as far as like documenting different types of activities and records within the TCMS system. So you'll want to familiarize with what those capabilities are. And again, we'll touch on that pretty organically as we go through different features today. On the left-hand side of Reconnect, that's kind of like our main menu, if you will. Again, I'm not really going to go through each of these icons because we'll sort of just cover those as we talk about the features that are important to this group. But I do want to highlight the client list. This is how you access, or one way that you can access participant records in the system. So when you click on your client list, you're going to be brought to a list of all of the profiles that you have access to in Reconnect. And clicking on anyone's name is going to bring you to what's called their client profile. So most of you should see at least one client on this list. The client should have your name. So just to view a sample client profile, click on your name on that client list and you'll be brought to that client's profile. So in the client profile, we've got two main menus. The menu in the middle with all of these blue icons, that's kind of the demographic warehouse. So that's all of their employment records, all of their medication info, their insurance information, their government ID, their judicial involvement, all of that kind of historical data and current demographic information about the participant. And then on the left, we have more of kind of like a treatment court activity menu. So this is going to be just records as it pertains to the participants' involvement in treatment course. So that's going to be a list of all their test results, a list of all of their contacts, all of their notes, any documents that have been uploaded. So kind of those ongoing records that you would, you know, be updating as they move through the program. Another thing I want to point out, and this is easy to explain if you're on the client list. So if you want to click on the 3 people icon for those who are following along, that's going to bring you to our client list. One thing I want to point out about Reconnect is that you can customize the columns that you see in these tables, in any of the tables in Reconnect. There's tables on the dashboard. The client list is a table. There's tables inside of that activity report in the client profile. So customize what you want to see on these tables by clicking the 3 bars in the upper right and turning columns off and on. So an avatar, for example, once we have photos uploaded of the participants, that photo will appear as like a small avatar next to their name. So if you don't care about that, you can turn that off. You can, in the client list at least, you can pin certain columns to the left so that they're always like right in view. So just kind of be familiarized with how that works and know that you can do that for any of the tables in the system. Those preferences do save to your browser's cache. So if you log into Reconnect on your phone or a different device, those preferences will not be saved. And if you clear your cache, they will all be wiped. So just know that probably every couple of months that's going to happen and you'll have to reset them. But generally, day to day, when you're logging in, those preferences should all save. Okay. We good to get started in kind of our first task? Okay. First thing we're going to talk about is logging contact with the participant. This includes logging individual sessions as well as group sessions. All participant contact other than court appearances is logged through the same feature in Reconnect, and the feature is called appointments. So probation is going to log their contacts through this tool. Yeah, that'll be, you know, rather than field visits being logged one place through SCMS and treatment attendance being logged through a different place, all of that is going to happen through the appointments tool so that we have a unified attendance report for all of that participants, you know, scheduled contacts with various members of the team. So to log a contact, you first have to create an appointment. There's a couple of feature enhancements coming for this tool in, I'll say, like early 2026. I'm not going to commit to an exact timeline, but we've already done a lot of foundational work for it. So as we're talking about how to log attendance and log, you know, treatment group attendance as well as individual attendance, I will kind of pepper in some enhancements that we have coming down the pipe, just so you know that we're sort of thinking about the next phase of this tool and how to make it more convenient depending on how you log your group and individual appointments. So I'm going to show you first how to schedule a either individual or group session, and then we're going to talk about how to log the outcome in terms of attendance and any notes for that session. Right now, this is a 2-part process. So you've got to create the session before you can result it. There is a benefit to that and sort of it staying that way long term if your program is using our participant engagement app. So if you're using our engagement app, when you schedule your group or individual sessions in advance, the participant will see that session on the home screen of the app as a calendar item day of. And they'll also get a push notification reminder from Reconnect that says, hey, remember you have group today at 5 p.m. So scheduling your contacts with participants in the future, as opposed to just logging them retroactively, does have its benefits for providing additional support and accountability to your clients for their required group sessions or individual sessions. So to create an appointment, I recommend just doing this right from the dashboard. There's a couple different places that you can do it that I'll show you. But if you launch that quick action from the dashboard in the lower right and you click add appointment, this is the form that you can use to set up your appointment. So first and foremost, you note that you can add multiple participants to the appointment. So you do not need to schedule, if you have group with 10 people tomorrow night, you don't need to schedule each of those appointments individually. You can create one appointment and put all 10 of those clients into it. On that note, from the perspective of treatment groups, I also want to call out this little wrench icon. And if you click that, there's different ways that you can select participants in bulk, the most important being this client groups option. Client groups is a very customizable, easy way to categorize groups of participants so that when you are doing something like creating an appointment or sending an announcement, you can select that entire group in one click as opposed to having to populate each of their 10 names individually. So if you have 10 people who go, you're hosting a seeking safety group on Monday at 5 p.m. and you have 10 people that are in that group right now, we can create a group for Joe's seeking safety group and put those 10 clients into the group so that when you're creating your appointments, you just have to select that group and all participants who are currently in that group will be selected by default. So groups are something that your coordinator can create, and then you just put the participants into groups and take them out right within their client profiles. So it's a really easy feature, very customizable, that'll allow you to save some time when you're, creating your appointments if you do host a lot of group sessions. For those of you who are following along, just go ahead and select the one client that you have access to. I'm going to use a different test client. Joe, I was hoping you had a test client in the system, but it doesn't look like you do.
I've never made one. Now I wish I had. Darn it.
I'm just gonna use this person's. So select a client that you have access to. If you clicked the wrench icon, just click it again to get rid of those bulk selection things and get back to the main add appointment screen. Then you're gonna give your sample appointment here a title. So I'm just going to call it like a lost office visit. You're going to put the date and time of the appointment here. And again, if you're scheduling this in advance, the participant will get a reminder about this appointment the hour before. You'll notice that we do have the ability to set appointments to automatically repeat. So if you have, host a seeking safety group every Monday at 5 p.m., you can set that to a weekday repeat of repeats every week. Weekday is Monday. And it's going to default the time that you selected already. The thing that I want to point out about repeat appointments, we have a couple of limitations to be aware of that, again, are like already on the radar, but definitely not going to be enhanced by Go Live. So if you have, say you have a group every Monday at 5 p.m., if you schedule that group to repeat every week, and you need to edit or delete an individual instance, it's going to edit or delete all future instances of that appointment. So we know in Outlook, if we have a repeat weekly Outlook event, we can go into, Monday from 2 weeks from now, it's going to be a holiday. I'm not going to have that meeting. Just on that Monday, I'm able to edit or delete that individual instance of that recurring meeting. Reconnect doesn't offer that yet. So if I delete that Monday group, it's going to delete all future instances of that. So I'd need to go in and create it again to start the following Monday to repeat the following Monday. We will definitely be enhancing that. It's been on the radar for a while, and I'm hopeful that that'll be an early 2026 goal. But in the meantime, you guys definitely need to be aware of that limitation if you are going to try and use that repeat every week or however, repeats function. The visit type is going to be the category of the appointment. We'll be adding some additional categories, but these should be pretty intuitive as to whether it's treatment group or individual counseling. The format is virtual or in person, essentially. And then the service is where you can select yourself as a service provider. This is something that your coordinator will have to, they'll add you as a service provider in your account. You won't see yourself in this drop down right now, so you can feel free to leave that blank. But appointments can capture, it'll capture you as the author, but this just kind of helps to clarify you as the provider. Your agency and your agency's address. So the service dropdown just defaults all three of those preferences to the appointment that you're creating. And then you do have the ability to put a URL into the appointment if you are using our participant engagement app and this is a virtual session. You can put like the Zoom or whatever service, video chat service you use, a link to that, and the participants will be able to click the link from the app. So go ahead and add an appointment for your test client, and I'll say Erin Lost, or I'm going to set this to be tomorrow. Click add. So now I'm going to show you where that appointment that you created went and how to result the outcome. Before we do that, I want everyone to click on this plus sign and click add appointment again. So one of the key enhancements coming to this tool is that you will be able to result the outcome from this screen in the event that you did not schedule the appointment ahead of time. So again, there's a lot of benefits to scheduling the appointments ahead of time. Or that participant engagement side of the house where they get the reminder, but let's say your program isn't using our engagement app or you just didn't get around to scheduling your appointments ahead of time. If you're just logging a contact retroactively, this two-step process probably feels a little labor intensive. So we will be adding the ability for when you're creating the appointment to result the outcome on the same screen. And that is definitely a high priority. So know that that will be available soon. But for now, regardless of whether you're just logging the contact retroactively and hadn't scheduled the appointment, or if you did schedule it in advance, either way, you've got to create the appointment before you can result the outcome as Reconnect exists today. So to log that outcome, appointments are part of our event portal, and they go to our event service, which is this calendar icon with a star on the left. So everyone who's following along, you're going to want to click there. And once you click on that calendar icon, you're going to click into where it says appointment log. And if you don't see the appointment that you scheduled, especially if it was in the future, just click in the upper right where it says up to, toggle that to be a few days in the future, and you should see that appointment that you created. The other thing to note is that the appointment log defaults to logging all appointments from the past month. And that can cause it to sometimes load more slowly depending on how many appointments we're trying to capture. So if you're ever just needing it to load faster, as it's loading, you can change the time frame that it's loading for to be much shorter, and it should spit out the appointment you're looking for a little bit faster. I created an appointment for a different client this time. This was the one that I created right here. So to log that outcome, I'm going to click where it says log, and I'm going to document. The outcome is kind of the attendance record, the visit notes, and then the hours attended. So hours attended is a very important metric for capturing this participant's overall involvement in the treatment court. this is going to allow us to calculate the dosage of different services and treatment modalities that the participant is receiving. So as we look at long-term data and things like recidivism rates, this allows us to see, like, you know, how much dosage of probation versus treatment versus case management is this participant receiving, and how does that impact outcomes over time? So this hours attended needs to be accurate so that we can calculate that dosage correctly. It's going to default to the length of the appointment that you scheduled. But let's say you scheduled it for an hour, you only end up meeting with them for half an hour. You're going to change the hours attended to be 0.5. So this is all based around hours. So if you end up meeting with the client for 90 minutes, you don't want to put 90 in here because that's going to equate to 90 hours. You would want to put 1.5. An hour and a half would be 90 minutes. So that's how you kind of document that, the dosage of treatment that the participant received. Another thing I want to call out for this group is right now, in terms of like when you're creating an appointment, and actually Danielle and I talked about this last week, Joe, we're probably going to add another couple of drop downs to either the screen and or the add appointment screen that allow you to drill down to the specific type of treatment that the participant is receiving. So right now you have a title, which is not reportable, and then you have like group session, but there isn't an additional field for you to, you know, select IOP or select whatever the specific treatment type is. So we'll either be adding that here or to the create appointment screen or both, so that we can calculate the number of hours of specific types of treatment that the participant has received rather than just treatment as a whole. Visit notes. So we're going to talk about 2 ways that you can document notes for court in Reconnect. This is one of them. All appointment notes will appear on the staffing report for court. Some providers are likely going to use this to provide their staffing notes. You need to use this feature at a minimum to log your contacts, but whether you choose this to put your detailed notes for court or not is kind of up to you. We have a more general notes feature that allows you to provide more of like a general summary. So if that doesn't feel appropriate to put into a visit note, we have another way that you can do that in preparation for court. So this is one of those options though, and I think you're welcome to use that, the visit notes feature, as long as that feels right for documenting your meetings with someone. So once you log your outcome, we'll see that appear in the log here. Another enhancement that we do have like written up and ticketed is the ability to select multiple items within the table and result them all at once. So that makes more sense if you have this filtered to, say, you know, your treatment group, which you scheduled for multiple people. So if you had 10 people in group last night and you need to result the outcome for those 10 people and 5 of them no-showed, right now you've got to click into this log button for all 5 of those people and click missed, 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 missed. So we will be adding the ability to select all 5 of those people in the table and then doing a bulk update. So that will come as well. And I'm hopeful that's, again, kind of a pretty first 3 months of you using Reconnect, you'll see that functionality. Don't quote me on that, but I am going to be pushing really hard for that. So know that that's on the agenda, on the radar. I saw a thumbs up, so that's good. Any questions before I continue on here? Okay. So let's say that you need to edit or delete an appointment that you've scheduled. The easiest way to do that is, we're still in that calendar icon with a star, and we're going to toggle up to where it says Event Explorer. This is going to show you a list of all the appointments that you've scheduled by the participants that you select. So if you want to see all the appointments for your whole caseload in this court, you can, where it says select clients by name, you can just do all clients. Or if you're just trying to locate one client's appointment, you can select their name and then click search. This is going to give you a calendar view as well as a list view of any appointments pertaining to that client. And on the list view, it's going to default to kind of chronological order for the month that you're viewing. So I'm viewing the month of December, so it's starting at the beginning of December, and then I can scroll down to current and future days in the month of December. You'll notice that the trash can icon is not available for past events. You are not able to delete appointments that are in the past. You can only delete, and really you can only edit appointments that are in the future. So just know that if you're trying to locate an appointment to delete, you've got to scroll down to the current day to get either a present or future iteration of that appointment to be able to delete it. If you don't delete it by accident, you can just result the outcome as like rescheduled or something like that, so that the other team sees that that appointment was not missed. Staying right here within the event service, you note that on the left there is an add appointment button here. You can create appointments here as well. We don't have that service drop down feature, so you've got to type in your service provider information. It's also a little funky for selecting multiple clients, so I kind of advise using the dashboard version for scheduling groups. Because you can only select multiple. You select group counseling, and then it asks, do you want to schedule for more than one client? And you say yes. And then you can select multiple clients, but we also don't offer the ability to select by group here. So it's the same thing, but just kind of a little more inconvenient. But know that it works fine. And if you find it, the only thing I kind of like about it is that it's here right next to the appointment log, as opposed to the dashboard quick action, which is like on a different screen. So just want to call that out, that that's there. You're welcome to use it, but it does have some limitations. One thing I do like about this, you can still do this from an appointment that you create on the dashboard, but you've got to like go to the Event Explorer and edit it to be able to do this. When you create appointments from here, you can add additional push notification reminders from the app, and you can also customize the delivery time. So just some added functionality for that engagement app piece that's good to be aware of, that when you're creating the appointment from the dashboard is not available. You've got to basically create the appointment on the dashboard, then come to the Event Explorer and edit the appointment. And then you can customize the reminders for that appointment that you created on the dashboard. Last thing I want to point out related to this feature is, where do this appointment attendance records go? So they definitely go on the staffing report, which we'll talk about a little bit later in the training, but they also go to the client's profile. So if everyone who's following along wants to visit their test client profile by clicking on the 3 people icon on the left, and then clicking on your client's name, on that left-hand activity menu, you're going to click where it says events. And that's actually a drop-down menu. So once you click on that, you can click below where it says appointment log. This is going to be a log of appointments just pertaining to this one client that you've selected. So you can easily see other appointments and attendance records that are being logged by other team members. Just note that it defaults to only showing appointments for the past month. So if you want to go back further than that, you've got to toggle in the upper right. Okay, any questions about creating and logging appointments? for group or individuals? Yes.
I have a
Melody.
quick question. Oh, sorry. Go ahead.
Oh, no, you're good. No worries.
Yes, I have a question. Can you hear me?
Yes.
Okay, so on the appointment details, I think you started going just a little bit fast for me at the end there. Where is it that I would document a no-show, no-call, or whether I outreached or not? Where I don't see the visit. I see the visit type, but I don't see whether it's captured under appointment details. Like the old way, we had a drop-down box where it said excused or attended.
Are you in this screen right now, the add appointment screen?
Yeah, I'm in add appointment.
Yeah. So right now you can't document that data from add appointment. We will be adding that functionality soon, but right now you have to schedule the appointment and then you go into the appointment log to document those results. So it's a two-step process. So you want to put just, if you want to put like a sample date and time in and click add, then I'll show you where you go to results that the attendance for that appointment.
Okay, so I need to add an appointment. It's not letting me add a person here. Event title, no, add.
You shouldn't be seeing event title.
No, add an appointment. Okay,
And then
where do I select the client when I add an appointment?
yeah, so at the top of the screen, do you see clients with a little caret drop down next to it?
No.
Do you want to share your screen? Yeah, I'm just wondering, maybe, Joe, Melody was one of the folks who didn't get the email. Did we assign a client to her?
Yeah, I did. It's not the email that I didn't get. I wasn't able to open because of the firewall, the video.
Okay.
I'm logged in and they've given me myself as.
So when you're on that add appointment screen, do you see the very first field should be the client drop down?
Yeah, it just says title.
So above that, you don't see where it says clients? I'm also wondering if you are not on the dashboard, but you may be in this add appointment here. I'm guessing that's probably where you are. Can you see my screen
that's
as
where
well?
I'm at. Yeah, that's where I'm at. Okay.
This one works. It's not as intuitive. So you would put your title, your date, and your time. And only once you select visit type, and you could just do individual counseling, at that point, the option to select a client will appear below that.
Okay, so I was able to collect a client. I see. Date enrolled. Okay, I see. Thank you.
Yeah, no problem. And then you'd hit create event. And then you go to that appointment log. And just know that when you go to the log, if you don't see that appointment that you just created, in the upper right where it's loading appointments up to today's date or tomorrow's date, just push that a day in the future. Sometimes it doesn't load future appointments exactly to the dates that have been selected, which is annoying. But typically you'd only be resulting past appointments anyway, so.
Okay, I see my group now. Thank you.
Awesome. Yeah, no problem. Other questions? Sir, you had a question. In the green shirt.
Sorry. Yeah, I completely forgot what I was gonna ask. I actually, it's coming back to me. Did you say that our coordinator needs to add us as for that column that says server, like
Yeah.
service?
Yeah.
So if we're the treatment provider, they're the ones that are gonna add us as a treatment provider on there. So that way on the drop down, our name
Yeah.
comes out with treatment provider on there.
Yep. It's a super easy setting. You guys won't have access to settings, but it's just in settings under appointment services. It's just your name, you as a provider, and then the address. So
Yeah.
one thing to note is that that address does, I'm quite sure it goes into the app. So if you offer services for multiple locations, your coordinator could also add you as a service provider at each of those addresses so that when you're scheduling an appointment, you're selecting yourself as the provider with the address of the appointment that you're scheduling.
Okay.
That'd be if you offer services at multiple locations.
Sounds good. And the additional question that I had was, when you're adding appointments, you said that little wrench gives you a
Yeah.
drop down menu for you to be able to select groups that have multiple clients. Is that something that we can edit, or do we have to have our coordinator also do that?
So your coordinator creates the group, which is super easy. So we go to the, again, settings, client groups, and then all it is like free typing into one of these fields. So it's super easy to create groups. And then the way that participants get added and removed from those is in their profile. It's the account information demographics section. There is a client group drop down there. So any groups that have been added in settings will appear in this drop down, and that's where you put participants into the group and or take them out. Yeah, so you could give your coordinator a list of 10 groups that you want to create. And honestly, that's probably something that we can unlock for other team members if that makes sense. There's not really a lot in there, Joe, like that people shouldn't see. So
yeah, that's what I was just gonna say. Just so everyone's clear, as far as deciding like the hierarchy of who has access to what, we kept it pretty open. There were a few things that we at OJD were like, okay, well, this will be coordinator only, this will be treatment provider. But in full disclosure, we don't have the final system to look at either. So we're continuing the conversations with Sophie and her team. And as you're saying that, Eric, I'm thinking the same thing. Like, why are we not letting them just handle this themselves? Because I can imagine if you had updates to your groups, people who are showing up at different days, it'd be kind of a pain to have to tell the coordinator. So
Yeah,
that's something we can take back. And
yeah.
if it's not
absolutely.
something on, yeah, and if it's not something on day one, that doesn't mean that it's permanent either. We're I'm writing this down right now so we can take it back to our team to talk about. But I appreciate you bringing that up because that hadn't even crossed my mind until you said it today, Eric. So
Right on. Thanks.
I appreciate it.
any other questions? Okay. So now we're going to talk about logging a general note. So if everyone wants to navigate to the dashboard, and then in the lower right, again, to get to the dashboard, you click on that speedometer icon in the upper left. And then to show you one way you can log a note, we're going to click on that quick action again. But instead of clicking add appointment, we're going to click add bulk note. Don't be thrown off by the word bulk here. You can select multiple clients and log the same note for each of them at once, but you can also just select one client. So the reason that I want to show you this on the dashboard is because if you do end up using this feature to basically document your summaries for court, I think it's easier to just do one after the other right here from the dashboard, rather than having to go to each client's profile and log that court summary there, but you can also do that. So go ahead and select your client that you have access to. And just for date and time, just make sure you select today's date. I don't know that you need to worry that much about the time, but our staffing report pulls in notes and other pieces of information based on date. So you need to make sure that this note has that, general date and time that it's being logged. You don't need to know a participant's future court date to be able to log a note. So I know that's kind of one of the current pain points of SCMS. So the date and time should just be today's date. It's not the date of court. So our staffing sheet just pulls in any data from the past 2 weeks or whatever the time frame is that you select. So you don't need to know someone's future court date when you're documenting a note. And then for the tag, you're going to want to make sure that you scroll down and select staffing from the dropdown. So you'll see lots of different tags for notes in Reconnect. You are welcome to use those, but know that only the staffing tag pulls onto the staffing report for court. And honestly, the other things that you might use notes for, so you need to use appointments to document your actual contacts with participants so that the team has access to that sort of treatment dosage that the participant is receiving. Things that you might use notes for would be the staffing notes for court. If you feel like you want to kind of put a summary of how someone's doing into this type of note rather than a contact note, which would be through the appointments feature, you can use notes for that. Or if you have a ad hoc phone call with someone and you want to log a note for that phone call, you might use notes as opposed to appointments for that, because it's not really a contact that needs to be documented from a dosage standpoint. I saw someone pointed out there's 3 staffing notes, so you can create custom tags. And we had some people over the course of the training create duplicate staffing tags. All of them worked for pulling onto the staffing sheet, I confirmed. That's kind of confusing, and we definitely need to make it so it's easier to create or delete custom tags that don't make sense, but that's why those are there for right now. But any of them work, so it doesn't matter which one you select. And then you would put your note here. So if everyone can add a staffing note for their test client, and then eventually we'll get to pulling the staffing report and you'll be able to see how these notes appear on the staffing sheet versus those appointment notes from the appointments tool. And then just click submit to document your note. Okay, so the dashboard quick action is one place that you can log notes for either an individual or several clients. If everyone can now navigate over to their test client profile, so click on the 3 people icon on the left and click on their test client. And on the left-hand side, you're going to click where it says records. Your staffing note will appear in the table below. You'll see you can also document a note here, so that's another option if you find that preferable. Our notes layout is a little unusual right now, so I want to call that out. There's a couple enhancements that I'll sort of talk about right now. We're definitely going to improve the way that notes are visualized here. I mean, this is essentially the notes are all in basically a spreadsheet, which is not really a user-friendly way to read someone's note history. So I just want to acknowledge that's on the radar. It's sort of a temporary layout to ensure reasonable load times with this page while we explore other ways to make notes more readable while still ensuring that this page loads efficiently as we look to migrate probably 1 million notes into Reconnect from SCMS. So that's a temporary solution. In the meantime, while this layout exists, just hover over the note and the note will appear in this pop-up, or you can click the edit icon to view it from that sort of edit note screen as well. While we're on the subject of editing a note, you will see that you have the ability to edit notes that you are creating. This is a feature that was not available in SCMS that will be available to you in TCMS, where you will be able to modify the notes that you create independently without having to reach out to your coordinator. The reason for that is now allowed is that when you edit a note, there is an audit trail of that edit. So I'm going to go ahead and edit this note that I created. And you will see that when I edit a note, a caret appears next to the note. And I can collapse and uncollapse that caret to see the original version of that note below. So here is the original version. And then this is kind of the new updated version above. So you will have the ability to edit your notes, but there is going to be that audit trail of the edit, when it was edited, who edited it, and what the original note was. Another thing I want to call out about Reconnect, again, just to kind of give you an idea of what we're already aware of, and what's kind of coming down the pipe over the next several months. Notes for, like, this only includes notes that are logged through that add note feature. It does not include notes from appointments. Notes from appointments go to the appointment log in the client's profile. Similarly, notes from court go to where the court notes go. So that kind of activity record is a little disjointed in Reconnect. So one of the things that we're prioritizing, which we'll probably honestly prioritize over improving this table view, is a combined activity feed for the participant's profile. So that will essentially be, reminiscent of kind of like a Facebook feed. Like if you went to someone's Facebook page and you could scroll through all of their activity, it's going to feel like that, but it's going to be their treatment court record. So all notes will go into that feed from the various tools, drug test activity, court appearances, treatment outcomes, like all that stuff is going to go into that combined feed. And the idea is that you'll be able to filter that feed for specific things. So if you want to look at just notes and not drug tests, you'll be able to filter drug tests out of that feed, at least eventually. So that's something that we're definitely excited about to hopefully offer in early 2026 as well. In the meantime, you kind of need to know where to locate different pieces of information, which for you all, you'll be in the system a lot. And we'll hopefully learn that quickly. But for folks like attorneys who are maybe just popping in to say hi and see what's going on, I think that activity feed is going to be really valuable for people in those types of roles. Okay, the next thing that we are going to talk about is logging behavioral responses and locating that information in the TCMS system. So if everyone is in a client profile, if you can scroll on that left-hand menu, scroll down to where it says behavioral responses. This encompasses incentives, sanctions, and service adjustments, which you know as interventions in SCMS. So I think for the most part, the idea is that coordinators will be the ones logging incentives and sanctions as part of the kind of resulting court outcomes for the participant. But service adjustments is something that we're envisioning being documented in real time as those adjustments to treatment are being made. So if everyone is in their test client profile and can click on behavioral responses, and then at the top of the screen, toggle over to service adjustments, and then click record adjustment in the upper right, you will see one of the categories of responses is a treatment adjustment. When you select that, you'll be given an option to select what the treatment adjustment is. And then you'll be able to select the behavior that you're responding to for that adjustment. With any notes and the date that you are documenting that. So go ahead and submit that for your test client. Joe, anything you want to add from OJD about this feature?
Yeah, I think just overall for incentive sanctions and service adjustments, our team reviewed the All Rise recommendation for categories and types of incentive sanctions and service adjustments. And we recognize that a lot of things we were calling sanctions are actually should be labeled as service adjustments. So when you start playing in here, you'll notice some changes in where things live. And we will be sending out to the coordinators the All Rise document that outlines that. So what we really tried to do with the configuration here is to try to match the best practices on this element.
Yes, Jamie.
So I understand the importance of having a lot of this information in this program, but from a treatment provider's perspective, like we only have so many hours in the day. And I know that I've like had this conversation with our own like treatment court provider in the past, and they've brought up the comment that like there's a line item in our grant that pays us to enter this data, which yes, there is, and it's not really like a money issue. It's how do we balance the paperwork with the people work, so to speak? And because this is a lot more reporting than what's currently in SCMS. And so I'm just curious what other people's thoughts are, or maybe suggestions on how to balance that.
I kind of want to jump in. I think it may feel like it's more work than SCMS, but honestly, just in my experience working in SCMS and then training on it, and then now TCMS, I think you're going to find that it's a lot easier actually in TCMS. But I do want to validate that I get that like there's not enough time in the day sometimes. I think that is a balance in treatment courts in general. So I want to acknowledge it and not feel like we're not. But I think the other piece to that is it does come down to funding sometimes. And I think that like the Criminal Justice Commission, if your program is funded by them, is going to be looking at this information more to decide how they fund in the future. They're wanting to rely more on data. So that doesn't necessarily answer your question or make it any easier, but I do know that's kind of the push we're getting. I will say that I know when I was a coordinator in a local program, we did work with our treatment provider to have like one of their admin staff help with this. I don't know if that's an option in your agency or not, but I do want to highlight that if you have like an administrative support person that works for you, we are able to give them access as well if that would help. But
Okay.
That's one idea. I know that may not be perfect, but that's just something I was wanting to share.
No, I think that's great. Thank you.
Yeah.
Any other questions? Yeah, Trista.
This one's going to be a complex, multifaceted question to pen out. So I'm currently the person who is documenting for our agency's treatment program and our treatment court. I am not the direct provider for the 8 clients. I am the representative of our agency to this treatment court. So as I'm looking here and how I've been sending my reports in, since I'm not the facilitator, I'm not the primary clinician, I'm the program manager for our alcohol and drug team, but I am the court representative. I've been just sending the email of, because there's going to be 9 to 12 different providers that I'm pulling reports from. How am I supposed to get that information in here?
Yeah, so I mean, I think you would log it in the ways that we've been talking about, but instead of defaulting to your name as the user who provided the adjustment, you would select the provider who shared that with you. And same when you're logging an appointment, you would, under the service provider, select the provider that you're logging the appointment for. Other
So
than
am I
that,
able go
Yeah.
back and backdate all of these things because I put their court reports in on Thursday, and I am backdating from the week or the 2 weeks, depending on what my previous Thursday looked like. So am I gonna just sit here and be like, okay, well, I have Jimmy, and I'm just gonna put in 9 appointments for Jimmy for 9 different people, and then go in and our system to see if he kept it, and then copy and paste the note over from another clinician?
I think one thing I would highlight is I don't know that you would need to highlight all the notes if you're doing attendance. You can if there's something that you think that they want shared with the treatment court team, but really if you're resulting the appointment, you don't have to put a note in necessarily. That's something you can share if there's information, but I think you don't have to do it like real time. I think is kind of what you're getting at, that you do it like once a week, right, for the previous few weeks. I think you could go in and do that. You can go in and schedule appointments and just result them later as well, too. So you could break it up if you wanted. I think it would really come down to what works best for you and your agency, I think.
Right. So the treatment court provider, the judge, and the treatment court coordinator who want all of the actual information from the result of the appointments that we've been putting in for the last 3 years, I don't think are going to go for not having a note put into the appointment.
So that's where I think it can be helpful to do what Sophie showed, just the notes tool for staffing. When I ran a program in Lane County, I asked my treatment providers just to result appointments and not put notes, and then do one overview of the previous 2 weeks that says, how they did, if there was anything I needed the judge or team to know, and that would be marked as staffing. So that's one way you could consider it and talk to your team. I know obviously it might be a shift from the way they're getting that information now, but it could be a way to remedy that. That was kind of how we trained on it in SCMS. I don't know if that's how it was always done, but in TCMS, you could do that so that you could just do like one overview note for staffing for each participant, and then just do the appointments.
How does that count for the dosage of treatment?
So you'd still have to enter the appointments and result them. You just wouldn't have
to
to
be
add
a
the note.
double thing. It's just going to be 2 things. Instead of doing it one way, I'm going to have to do it both ways.
I mean, whatever's easier for you. You don't have to do it that way. That's just an available option for you. I think what I was getting at is that if you have, let's say you have a participant who has 10 appointments over the last 2 weeks, you've scheduled those. Ideally, in a perfect world, if your participants are using the engagement app, you could even schedule them in advance, because then they know when their appointments are on their app. And then you could just go result them like the day before court or however it is that you do it, but you wouldn't need to copy every note into each appointment. You could then just go and add one staffing note in the notes section that said, Jimmy did well over the last week. A lot of programs ask a treatment provider to give like one positive thing, one thing they need to work on, something like that. And that could be something that you ask your, if you're just the messenger. I had someone in a role similar to you in my program, and I asked the treatment providers to give that the liaison, kind of like you're doing, to give them that information to drop in, so that the person in your role didn't have to come up with it. I don't know if that would work for your agency, but I think there's a few different ways that you can work on that. I see someone dropped a comment.
I was just asking about
Yeah.
when the coordinator adds those service providers. And again, we can definitely look at giving the ability to add service providers to other team members as well. But once that service provider has been created once in settings, they will appear in this service dropdown. And then you just are able to select the provider there. And then for you, Trista, I think, this just helps to explain how, for different programs that do it different ways, if you're not using our mobile app or you don't have the bandwidth to schedule your appointments in advance, you will be able to result those outcomes right from this add appointment screen soon, so that you're not having to do a 2-step process. It's probably going to look a little more similar to what you do now, where retroactively you're just going in and documenting those visits. I mean, I think now you guys are maybe doing just one note per time frame as opposed to documenting each visit individually. So that's a change, but there is a lot of benefit to doing it that way to be able to capture that dosage of treatment. But if you are just logging the appointment retroactively and you haven't set it up yet, the sort of add appointment, then log the outcome two-step process is cumbersome. So I think that, you know, in that world, you're creating the appointment with the date, the time, and then right down below is where you're going to have the visit notes and the attendance records. And I don't know, Joe, if we, you know, maybe we eventually look at, you know, one appointment that could, if the participant attended 3 sessions over the past 3 weeks and we want to just log all of that in one appointment, maybe we explore that in the future. But right now it would need to be individually per.
Yeah, and I think that earlier Christy dropped in the QR code with questions and suggestions. I'd encourage anyone who's got thoughts about it, you know, like Trista, what you were saying, if you wanted to drop that in there, that's all going to go back to our project team and the vendor to talk about, you know, if there's things that we could do in the future that would make it easier. We definitely want to hear your feedback and hear what your thoughts are. I think the other piece that I mentioned before too is it's gonna like things might shift a little bit too if your court decides to use the engagement app. Like you probably want to get appointments in earlier and then figuring out how that works so that the client can actually see their upcoming appointments on their app. But the other thing is, like Sophie mentioned, one of the improvements that's coming is that you would be able to schedule and result at the same time. That will take away one of the steps that currently exists. So Trista, I think that one might help you out a little bit once that's actually live in the system, which hopefully won't be too long after go live. But yeah, I understand. And I think honestly, for treatment providers, I've been doing trainings for a few years on SCMS and now with TCMS. This is probably the one area that we hear the most for treatment providers. We know that you all are doing a lot of work and it's a big ask, and there's not an easy way to sugarcoat asking it, you know, and I know that it's probably triggering, but we hope that this system does make it a little easier, even though it may seem like in the moment that it's a lot more work. I really honestly truly don't think it will feel that way once you're in there using it.
Eric.
Yeah, Joe, thanks for saying that. But I'm hearing that a lot of us are kind of just the liaisons, including myself, for trained providers. So a lot of us do our work on the back end. We collect all this data for a week or two, and then we're inputting it, right? If it were the counselor doing it, they could probably do this real time, take them 5 minutes, they're in and out. But we are not doing that, right? So that's why we get inundated with so much kind of back work that we have to do. And it sounds a bit tedious. I am looking forward to that new feature though, that you can actually log the outcome right then and there. So it can streamline the process a little bit for us that are just kind of the liaisons with treatment courts. But what I'm also hearing is, you know, and I'm also part of the Adult Recovery Corps in Washington County. And really, when it comes to individual note sessions, unless it's something that we really want to document, like they don't really care if we log in a note. For them, it's mostly what do we want to tell staffing in that general note for the last week or two that we've been dealing with the participant. And that's the type of feedback that I get from my counselors, and I put it in the staffing, what's going to go to staff on the staffing sheet. And that's really what the team wants, and that's really what the judge wants. But again, that's just the treatment court that I'm part of. I understand that other treatment courts probably want a lot more and a lot more detail, but I don't get in the habit of putting individual notes on every single one of them because it's a lot of work.
Yeah, I appreciate you saying that, Eric. And I think that that's something I want to highlight. I was a coordinator. I ran a program. I had team members, attorneys, judges who were like, I want to know every detail about the individual session. And the truth is, it's nobody's business on the team what happens in the individual session. That's between the client and the counselor. And so I think that, you know, that's something that if your local program is struggling with that, I mean, ask their coordinator to reach out to us at the statewide team. We can kind of do some conversations about that, because I do know that when I train, I try to remind everyone, you don't need to put every detail. Every detail of what they're processing with treatment is not relevant to the team. What's relevant to the team is if they've shown up, if they're engaging, and then maybe an overview if like we're working on honesty, or hey team, we worked through some heavy trauma this week, so you might notice that this person's dysregulated this week or is down or something. You know, those sorts of things are things that you want to share, but you don't really need to share everything that's occurring in treatment. Really, like if you do group sessions, I don't see much of a need to have notes from a group session. It's did they attend or did they not? Maybe the note is they were late and here's why they were late, or something relevant that staffing is that the judge and the team are going to want to know in staffing. But just putting notes in because they exist in your system, I don't know that that's necessarily something that your team needs. So, and I don't know, Trista, like I'm not sure what all is encompassed in your notes at your provider, but I think that that's something that I often remind teams, the whole team, judge, attorney, treatment provider, really nobody needs to know every detail. So that's kind of, that might be a hard, I mean, I know it's easy for me to say that when some of you have your own programs, but I'd be happy to explore more with your local programs. If you have your coordinator reach out to me, I'm happy to talk more about that. Sometimes it helps to hear it from other places, and I know I don't want to rock the boat locally for you by any means, but I do want to help try to, like, if some of you are doing a lot of work that really doesn't need to happen, then I would rather try to help you all kind of address that locally with your programs, just so that you can be successful and not feel like you're having to do as much work or more work than's necessary.
All right, so we are going to move into talking about logging UA results. For those of you whose program utilizes Redwood, and you're used to results automatically going into SCMS, Reconnect will offer that as well. But since we've got kind of a mixed group here today, I'm going to go through what the Redwood integration will look like, as well as how to log test results manually in TCMS. So on the dashboard of Reconnect, we have a drug testing report. This is going to display test results, but it's important to know that this report defaults to showing the current day. Actually, I don't know if date is date is a field. If you have the date field turned on, you can see that. So it's defaulted to today's date. I can switch to past and future dates of test results here, but just know that it's designed to only show like one day at a time of results. So test results will dump in here. They will also dump into the client profile. So for anyone who's interested in following along, you can go to your test client profile, go to the substance testing tab. Once we practice documenting a test result manually, you'll be able to see that there. Positive results will trigger an alert in the system. So any results that are automatically dumped in from Redwood as positive will flag a positive UA alert. And then we will be updating any positives to approved positive if that's relevant. Is that, Joe, is that typically something a treatment provider would do, or is, for the most part, is a coordinator going to update approved positives?
I think it depends. It's often, a lot of times, treatment providers or the UA collection facility. I think it depends on the location and how they handle UAs, but often it could be a treatment provider.
Okay. So yeah, Redwood results that are dumped into Reconnect as positives, you will be able to edit that test result. Yeah, I can't fully demonstrate the Redwood integration because that's not turned on for this account. Let me go back to the dashboard. Yeah, this is what it will look like. You'll be able to click into where it says positive and switch that to an approved positive. MAT data will surface in both the dashboard and the client profile reports. So as you are looking at the positives that have come into your account, you will be able to easily view a participant's MAT data, which is one of the columns in the drug testing report, so that when you're switching things to approved positive or deciding whether to do that, any MAT information that's been entered into the client profile will surface right in that table and allow you to just easily switch things to approved positive once that's been verified. So if we talk about logging a test result manually, just so you guys can kind of see some data in these reports, the easiest way to log a test result is again right from the dashboard, the quick action plus sign, click add bulk test result. Just like with the add bulk note, you can add a test result for multiple people or not. You can just select an individual, but it's just kind of a convenient place to launch that activity. So for those of you who do put in test results manually, you're going to definitely want to use the bulk test result feature because you'll be able to select multiple people. So if you're documenting multiple negatives, you can select all the participants who you're logging a negative UA for and be able to document that negative UA for all of them at the same time. But for practice sake, let's all log a positive test result for our test client. So we're going to go under add bulk test result. We're going to select our test client. We're going to document the attendance and the test result. And when you select positive, you can also log the substances found. We will be adding an additional drop down for positive UAs for the level that was detected in the test. So know that that will be an additional drop down when you select positive soon. You can obviously document any notes and then you submit the test result. You may have to refresh, but that result will appear in the drug testing report. So there's Aaron Lost's positive for alcohol that I just logged. So that goes into the report here. And then it also goes into his profile under the substance testing tab. Any questions? Okay. So for those of you who did just log a, yes, Melody.
Yeah, I have a question. So
Sure.
on attendance again, what goes in on attendance?
So that would be if they submitted the UA, the attendance would be reported. So the attendance field allows you to document no-shows in Reconnect if that's
Okay.
applicable for your program. Yeah.
Okay. And so there's no creatinine in this, just diluted is all we put if it's diluted.
This, just jumping in, this is not the final product.
Oh,
They are
okay.
adding more to it. So the fields that you're used to in SDMS will exist in Reconnect as well. They just haven't finished configuring it for us yet. So like creatinine is one of those fields that will exist.
And just to stay with consistent to evidence-based practices, especially I'm an All-Rise goer every year.
Yeah.
And I was excited to see that for the Therapeutic Alliance that the drug screens that I enter in that are positive in this system should no longer be a probation violation. Only the ones collected by the probation officer. Is that correct?
But I mean, I have also attended those sessions. I think a lot of that's going to depend on your local team's dynamic of how they have it set up. I know there's the like difference between like the therapeutic UAs and the supervision, I can't remember exactly the exact terminology, but I think that's going to depend on how your local program has it set up. I know that's the guidance. I think in different jurisdictions, there's less availability for that in certain communities, but I do think that one of the big pushes is that a positive UA should not necessarily lead to a confinement
Sanction.
or a harsh
Yeah,
sanction. Instead, it could be a
yeah.
service adjustment, right? Like maybe we need to discuss more in treatment about this, less about throwing you in jail.
Right, because see, what we run into sometimes is so, oh, your counselor's drug screening you today, so I won't, you
Yeah.
know, and it's like, you know, I just kind of feel like the probation officers should be UAing if they're going to sanction on them, and that's part of the punitive part of it, where the Therapeutic Alliance, you know,
Yeah, and I think, I mean, there's an overall push, whether it's probation who does it or treatment who does it, that really a jail sanction should not be an automatic for a positive UA for people who are, early in recovery or who are in this process, that there should be,
Right.
it should be addressed through service adjustments, which a service adjustment can be from treatment or it can be from probation as well. They have a whole arsenal of things that they can do as well for service adjustments that don't include jail or confinement of any type. So I agree with you, Melody. I think that getting each local program to that point might take a little longer and some more technical support and training, but that is I know that is the best practices and the intent that All Rise has and everything that they've been sharing as well.
Right,
hopefully
right. They came back with that this last year.
Yeah.
The guideline objective is that it not be, because
Yeah.
it really threatens the therapeutic alliance that we have, that, oh, I'm gonna drug screen today and then you're gonna tell my PO, it's, yeah.
Well, and that's why what we just went over, the service adjustments section, is a huge improvement. And you'll notice that a lot of the things that are in service adjustments used to be considered sanctions, but now we're moving it over that way to try to kind of push people to a different thinking, a different thought process.
Okay, thank you very much for that.
Yep.
Well, to follow up on that, we're going to talk about the alerts that are generated in Reconnect for positive UAs. So this is kind of a timely comment, but this is, the workflow that exists in our system today. So positive UAs are going to trigger an alert in Reconnect for the participant. Dilutes and no-shows will trigger alerts as well. So now we're going to transition to talking about what alerts mean in Reconnect and how they are documented. This is known as pending violations in SCMS right now, so it's a similar feature. So for those of you who are following along who just documented a positive test result, go ahead and click on the exclamation icon on that left-hand menu, and you should see an alert for your test client for that test result. And you can click on that alert in this table and mark it as confirmed or excused. So the basic idea with this terminology is that confirmed is documented official record, and excuse is there was a valid reason for this alert to occur. So at least in the short term, this is going to be pretty important for those of you that use Redwood, because positive UAs that come in from Redwood that are actually approved positive MATs, those are going to trigger a positive test result alert that needs to be excused because that was for MAT approved substance. Versus, someone tests positive for alcohol, you're going to just confirm that alert. And you can put any notes that you want, and other team members will have access to those notes when you document those alerts. Your alerts table, as well as the alerts table in the client profile, defaults to only showing you alerts that have not been responded to yet. So if you want to see more comprehensive, you just need to clear out those filters and you'll be able to see all alerts related to your caseload in the account, regardless of whether they've been confirmed or excused. If you navigate over to your client profile, just to see what this looks like in the client profile, if you go to the alerts tab on the left in the client profile, and again, you filter out, clear that filter for open alerts just by clicking this little X. You can now see all alerts related to this client, including those that have been confirmed or excused. Questions? Okay. Now we're going to move on to talking about documenting sobriety in Reconnect. And the way that I'm going to explain this is I want to show you what this looks like in the mobile app first. We're going to talk about our mobile app in more detail a little bit later, but I'm just going to give you kind of a sneak peek slide view. So kind of disregard what you see on the slide for now. But looking at this screenshot, we can see this dark blue tile shows me my sobriety, as well as kind of a personal goal that's been set for me, which is related to being nicotine free. So we use this feature, it's called Success Streaks, to document both official program sobriety as well as any other type of sobriety that you want to visualize for the client in the app. So if your program celebrates both program official sobriety as well as personal sobriety, you could have one streak that is personal sober date and one streak that is the program sober date. And then you can also set custom streaks for the participants. So if you do have a participant who is, trying to quit dip, you can schedule a streak for them that says dip free and allow them to track that independently themselves through the app. So we'll go through how to do that. Participants will not have the ability to update their program documented sober time in Reconnect. So we're going to go ahead and lock that streak so that they don't have access to it. But those personal streaks that you may choose to set for them will be something that they can engage with and interact with directly. So we're all going to set 2 success streaks for our test client. So to do this, you're going to go to your test client profile and you're going to locate the section in those blue icons that is labeled success streaks. And it's got that little flag icon. Actually, real quick before we do that, if everyone can locate the contact section of the client profile, there's a little, I don't know, it's like a person icon. If you see a primary phone number under add or edit phone numbers, and you see like this box right here that says primary phone number with that little orange minus sign, just click the minus sign and click save. We had some phone numbers that were like partially added by mistake, which makes it so that you can't save any data in the profile. So that was just sort of a little bug with my uploading all of these fake clients. Something went wrong with that. So that'll allow you to save in the client profile if you weren't able to. So to add a sober date, we're going to go to that section that's labeled success streaks. And where it says add edit success streaks, we're going to click to the right of that little plus sign, and that's going to create a streak for this client. In the title dropdown for that program documented official sobriety date, we're going to select the sober title. So sober for now, this is the only streak that will appear on the staffing report. So we are utilizing sober as that kind of program official sober date for our streaks. So if you were to select substance free, that will not appear on the staffing report. We know that different entities kind of word program sobriety differently. So we know that sober doesn't necessarily fit everyone, but it is the only one that's going to have that important function of displaying on the staffing report for now. So that is the one that we need to select for that program documented sobriety. You're going to, for the date, put the date of the participant's last negative UA. And then you are going to lock the streak. So again, if your program is using our participant engagement app, locking the streak makes it so that the participant will not be able to modify that date in the app, which is important. And then we're going to scroll up and hit save. And then just
Sophie,
yeah,
quick
go ahead.
question on that. So
Yeah.
I just noticed that this, in this test client, they had a failed UA on 12.8, but you were still able to lock in, or I was still able to lock in a 12.8 on my end. So there's no fail safe for that, because technically, that is not their last. That is not their last sober date.
Yeah, this is they're not linked to each other fully. Yeah, Joe, do you want to jump in?
Yeah, I kind of want to speak to that because in SCMS, we did link things completely. And on the staffing report, it would show days of sobriety. And we got a lot of complaints that people didn't like the way that was working, that they wanted to be able to control it. So we kind of thought this might be better this way. I don't know, but Eric, I agree with, I mean, I can understand where your head's going for sure. So we've had it both ways now. And so when we had it doing it, people said they were ignoring what the system was calculating and doing it themselves just
Well,
to make
it
sure.
might make
So-
sense. It makes sense because if somebody gets a failed and it could be like or a positive UA, it could be for a number of reasons. It could have been
Yeah.
excused, right? So the
Right.
coordinator or whoever still wants to be able to change it. So I
Yeah.
get it. I was just wondering like
Yeah.
why it allowed me to do that if they were not kind of like syncing together here.
Yeah, but there definitely have been conversations between OJD and Reconnect about different areas in the system where some things that kind of like integrate would be good. I don't know if that's one we would do in the future or not, based on the feedback we've had with SCMS. But that's a really good thing to point out, though, so that people are aware.
So just to practice, let's all add a custom streak for our test client as well. So underneath add edit streaks, we're going to click that plus sign again. And we're going to type in something free. So something free-handed. I'm going to write in dip free. When you add a custom streak, you have to click the drop-down suggestion that it provides. And then for this case, I don't want to have to modify this every time the participant uses dip. This is more of a personal tracker for them. So I'm going to leave this streak unlocked and I'm going to leave the date blank, and the app is going to prompt them to update that date independently, and they'll be able to change it anytime they want if they do use dip again in the future. And then if someone does test positive, their streak needs to be updated. And the way that you can do that is you can either just delete the date and leave it empty, or you can remove the whole streak and recreate it once they've tested negative again. Okay, any questions before we move on? Okay. So just kind of staying in a client profile, we just wanted to draw your attention to a couple of sections that you would likely be updating for your treatment court participants. Before we dive into that, I just want to call out that just like with sort of the tables and customizing the columns that you can see, you can also reorder the sections of the client profile. So if you're going to spend a lot of time in success streaks and you just want to have that be at the top, you can click on these dots to the right of the section and drag it to the top so that it's at the top. That will save to your browser cache again. So just anytime you clear your cache, you'll have to reset those preferences, but otherwise they will stick as you're visiting different profiles and logging into Reconnect. So one area that you will definitely spend some time is the screening section. This is fully not configured for OJD providers right now, but this is where you'll log your assessment results and document the scores of the assessments that you're administering. So there'll be fields and drop downs related to the assessments that are used typically in Oregon. Another section is the treatment section. Specifically the MAT section of treatment here. That's where you're going to document any MAT that participants are on so that that can display on the drug testing history as well and make that information easily accessible there. I think it's good to just kind of familiarize with some of the other demographic sections, but again, I would sort of wait until they've all been configured for OJD. But I think those are the key areas that treatment will need to update on a regular basis within the profile outside of the success streaks. And then also, if you're used to uploading completed assessments in SCMS and just kind of transitioning to how we upload documents and Reconnect, that happens on that left-hand menu of a client profile in the Documents tab. This is where you would upload documents like completed assessments or any other documents that the team needs to have access to. One feature that I'm going to just give you kind of a high level overview of is the ability to record treatment plans in Reconnect. Joe, anything you want to say to set the stage before I explain this further to the group?
Yeah, I think that which like Melody, as you were talking about earlier, like listening to some of what All Rise has been talking about and what, you know, some of the best practices talk about having combined goals and treatment plans, integrating what treatment's expecting of a person and maybe what probation is expecting, and then also integrating what the program requirements are. And up until now, we have not had a good way to do this in SCMS. And what Reconnect is doing and what Sophie's going to talk about is something that they're building into the program. It's not live in the system yet, but it's something that we will be receiving that's going to allow you to sort of integrate all three of those in a better way so that the whole team is sort of rowing in the same direction. So that probation's not over here doing one thing while treatment's doing this, while the court is requiring this. This is hopefully something that's going to help bridge that gap, I think is the best way I can describe it. And then I'm going to let Sophie explain what it is, but I think that this is something that I think we'll probably want to offer additional training in the future once it is live and once people are used to the system, sort of integrating some of the best practice thought process along with what the system functionality is. I think I'm just going to speak for myself that this is a really exciting tool. And right now I wish I was still a coordinator so I could go implement it in a program, but I'm excited that you all will have that opportunity and that we can support you through it. But I'm going to let Sophie talk about it now.
Yeah, so this is basically the tool that we'll be using to document a participant's phase goals and their steps toward completing those goals. And that same format template overview can be utilized to document treatment plans as well. The way that this works is that any type of goal that is set, like phase 1 goals, for example, those are pretty much, there's going to be a standard set of goals that apply to every participant. And those are going to exist in a template that staff will be able to use over and over again. So the same thing goes for treatment plans. If you have kind of like a standard treatment plan structure, you would create that as a template that you then can apply to multiple participants over time. So you're not having to type up the entire treatment plan every time, but you save that template. And then when you apply that treatment plan to a participant or phase goal, set of phase goals to a participant, you can then edit and delete items within the goal for that individual. So if part of your standard treatment plans involve, family dynamics and the participant who's you're applying the plan for doesn't have any family members, you could easily then delete the sort of family pieces out of the treatment plan. As well as easily add additional custom steps that are unique to that individual. So the idea is you're not having to type the whole thing up over and over again, but you're able to reuse that sort of standard plan and make any adjustments that are unique to the client. The basic structure of the goals is that they will have a set of parent steps and then child steps below that. So the parent steps would be kind of those high level objectives. And then the child steps would be the smaller action items that are helping the participant realize like what are some tangible steps that I can take to work toward this overall like bigger goal. So an example would be, I'm working toward obtaining employment. What are kind of 5 steps that I could be doing to work toward obtaining employment, especially in the short term? So these screenshots here just kind of help to visualize that. These are each of the parent steps, and then you can uncollapse each parent step to get those individual steps below. And again, all of this will be in a template format, but you'll be able to make modifications to both the parent and the child steps per the individual client. Each step will have a status, which will include things like, more granular statuses, making satisfactory updates or progress, making unsatisfactory progress, complete, incomplete, all of those, granular statuses. And then each step you'll be able to click on and a notes feed will appear to the right where you can document notes and updates related to that step of someone's treatment plan or phase goals. And the rest of the team will have access to those notes as well as to the plan itself. Eventually, soon. These will be visible to the client within the app. The participant will not see the notes that you're documenting, but they will see the steps and the statuses. So that's just kind of an overview of the feature. For now, just to sort of get a feel for this, if everyone is in their test client profile and can launch that quick action in the lower right and click assign goal and just select the phase 1 goal template from the drop down and click assign. And then on the left, click where it says goals. And then you can click on and open that phase 1 goal that you've assigned. This is our current goals feature. It's quite different from the treatment plan and phase goal structure. Like, we can't have child steps in this version of goals. There's only just like one level of steps essentially. And steps don't have granular statuses. There's just this bubble, and you can mark the bubble as complete or not by clicking on it and clicking approve. So quite a bit different than what I just showed you in the slide deck, but this just kind of helps get a feel for where the data will live, how you'll locate it. And then you see we've got this edit icon. So I've applied this general template to Erin Loss, but if I click edit, I'm then able to make modifications, remove things, change titles, add additional steps. So again, this whole screen will look a lot different, but the idea is that you're using a standard template and then easily able to make modifications and customize it per the individual. So as Joe said, there'll be a full training on this feature once it's live, but that, is definitely still in development. So only able to show you kind of that introductory overview today. All right, we're going to move on to pulling the staffing sheet for court. It varies a lot program to program if treatment providers and other sort of community partners are really pulling this regularly, or if the coordinator's the one pulling it. So obviously whatever tradition you have will probably continue to be the case, but want to make sure that everyone knows how to pull the report and can pull it today for their test clients so that they can see some of the data that they've been entering and how that appears on the report. So to pull the staffing report, we're going to click on the report icon and we're going to click staffing sheet. And then we're going to, for now, you're just where you're selecting sections for the report, you're going to select all sections. Excuse me. Once we go live, or shortly after we go live, some of these sections will be selected by default. Right now, you have full control over which sections you select, but some of them will be selected by default. Others will be customizable to pull into the report, depending on what the judge and other team members want to see when you're pulling this report. Down below is where you select the clients that you're pulling the report for. So for now, you can just, under the clients dropdown, select your test client. But notice that we have that bulk selector. So if you want to pull the report by caseload, by client group, any of that you can do. And then we also have a court docket selection. So if you toggle that on, you can just select all the clients who are scheduled for court that day. But just for the purpose of familiarizing with the report, just go ahead and select just your test client and then scroll up and you're going to click the Fetch Report button. Let that load for a second. And then once it loads, you're going to click the View PDF. So if there's been a photo uploaded for the participant, you'll see that here. You'll see their sober time here. You'll see any test results, any behavioral responses. And then importantly, what we want to point out is here are those staffing notes. So those general notes that have the staffing tag. And then in the lower right is where those appointment notes and attendance records go. So just to kind of point out where that data lives, depending on how you choose to enter those notes for court. Any questions?
Can I highlight one thing real quick? I've said this
Yeah,
a few
for sure.
times, but I wanted to let you all know I have gotten a lot of feedback from people in SCMS that they didn't like the staffing reports in SCMS, that they felt clunky and cluttered. And so I'm pretty excited about the layout of the Reconnect staffing report and just wanted to highlight that for you all. That I also think there's a lot more information in here that we didn't necessarily get in SCMS. So just wanted to give it a little shout out plug there.
Thanks, Joe.
Mhm.
Okay, so in the last couple minutes, we're going to talk about our participant mobile app and the capabilities of that. And then we're going to go through how to use the communication tools of that, one of those features. So Reconnect Community is the name of our participant mobile app. It is designed to be used in tandem with Reconnect's case management offering. It is not a requirement. You can use the case management feature without ever touching the participant mobile app, but it is meant to be an enhancement that can connect your participants to your team and to various resources that your program is providing, and just kind of help to break down barriers in terms of access to information and resources. So certain things automatically integrate with the TCMS offering. If you have your participants using the mobile app, that includes the court reminders. So if they have court scheduled, that'll automatically appear in the app. Their sobriety time will appear in the app. Any appointments that you schedule will appear in the app and deliver a notification reminder to them. So those three features just kind of automatically work with the app, and you don't even, all you have to do is use the TCMS tools correctly, and the participants will automatically benefit from those. There are additional add-on features. So in terms of goals, once those treatment plans and goals are available, those will be optionally visible in the app. They won't be visible by like requirement. You'll be able to sort of turn the participant view off if that's applicable. You can upload both websites and PDFs for participants or groups of participants to view in the app. We have a learning management system, so you can assign courses to folks that have both kind of life skills and basic treatment sort of peer voices courses to folks in the app. You can communicate with participants, which we'll talk more about. You can share announcements. So if your treatment groups get rescheduled, rather than having to like call 10 people or send 10 individual text messages, you can just send an announcement out to that entire group and say, hey, like we've changed rooms, or group's been canceled today last minute because of weather. So being able to communicate with people in bulk is a huge benefit to using the app. And then we do offer support group attendance verification. This has been a popular way to use the app so far in Oregon, where you can basically use the app to have participants check in with their photo and location when they get to a required group. And then they can reflect on the group as well through the app if that's something you're interested in. So a lot of programs use the app that way, where every week the participants have a recurring goal that says check in at support groups twice and do 2 support group reflections. And then the participants engage with that goal to launch those check-ins, launch those forms, and submit that verification directly through the goal. And the idea is that when they hit that goal, they get kind of like a positive reinforcement celebration notification from the app. So there's all different ways it can be utilized. It's not required that programs use it, and it's not required that they use it in a certain way, but it is definitely heavily encouraged, because there's, again, just using the core functions of the TCMS system, even if you didn't use any of those add-on features, would be beneficial to clients to help support them in getting to court and making all of their various appointments. So here are just some screenshots from the app. One feature that we didn't really have time to get into today, but I think it's important for treatment providers to know about, is that Reconnect does offer drug test randomization and scheduling. as well as a participant notification system for test scheduling. So if you are responsible for test randomization for the court that you support, and you are looking for a more automated random strategy for that, definitely reach out and we can help set this feature up in your account, but it has the ability to randomize your drug screens according to when your agency is open and available to test and how frequently each of your participants need to test. And then we have an in-app check-in service that allows participants to check in to see if they have to drug screen. And we also offer a call-in line for that as well for people who don't have access to an app. So this shot on the left just shows what it looks like to check in for drug testing. This sort of middle screenshot is just another example of what the homepage of the app looks like. To the right of that, we have one of those interactive goals where the participant is checking in and reflecting on support groups, as well as a more personal kind of engagement goal, like let me know about a healthier pro-social activity you did this week and upload a photo and a brief description. And then just an overview of what our messenger looks like from their end. Joe, anything you want to add before we kind of quickly cover messaging?
I think, well, since you're going to talk about messaging, I'll kind of just mention the like the check-ins for support group. That does drop a GPS pin location. Messaging also does drop a GPS pin location. One of the things that we've talked about in every session, and especially with the attorneys and judges, the idea behind the GPS pin drop for support group check-ins or for messaging, or if they're checking the UA line, is not gotcha to try to like pin them to jail. It is more for treatment. It is to address this like dishonesty, and we all know that people when they're beginning their recovery journey sometimes have a problem with honesty, and so we want this to be used as a treatment tool, not as a like supervisory tool. It's not intended to be something to get probation violations on or to put people in jail or on road crew. So our intent, and hopefully everyone follows along with that, is that it's used more for treatment purposes and addressing treatment. We'll see what happens, but that is the intent behind it.
Okay, so last thing we wanted to talk about was just how to utilize that messenger, which keep in mind, this communication suite is available to communicate with participants, but you can also use it to just communicate with other staff members. So we're encouraging programs to think about using this in Reconnect communication to do virtual staffing prep, or if you need to discuss an incident, this is a more secure place to have those conversations with other staff members compared to email. So just know that you don't have to use this to communicate with participants, but could still potentially benefit from knowing how to utilize it in general. So to communicate and reconnect, you click on this chat icon here. And then to open a chat room with either a client or other staff, you click this plus sign.
You're not sharing your screen anymore.
Oh, thank you. Thank you so much.
Yeah.
So we're in the chat icon here, and then we're clicking where it says rooms. We're clicking that plus sign. We are selecting any clients who we want to put into the chat room, and or adding additional staff members to the chat room as well. You can only put up to one participant into a chat room, but you can put multiple staff. So we don't offer like group chats with multiple clients right now, although that is a capability of Reconnect. But for now, it's just either group chats with multiple staff or with up to one client. And then you create the room. Just note that you can name the chat room. I don't advise doing that for individual chats with participants. That might be applicable for group chats with multiple staff or scenarios like that. But otherwise, if you're just chatting with one client, don't name the room. It gets confusing. One thing I want to point out is that participants cannot message you in Reconnect unless you initiate a chat room with them. So if you have people who do not want to open the door of communicating with in TCMS, you can just never start a chat with them and they will never be able to message you. Once you start a chat with someone, they can message you at any time until you archive that chat. So just kind of, that's how it works. Participants can't just elect to message anyone they want in Reconnect. Everything that is sent in here is permanent, can't be altered or deleted by you or the participants. So just know that this is kind of, should be seen as like an official record. So you don't want to have HIPAA compliant, like HIPAA conversations in here, or talking about, that sort of data in these chat rooms, because other team members who are not HIPAA certified will have access to that information. So this is great for kind of administrative communication, ad hoc scheduling changes, things like that, but not great for kind of those more personal treatment conversations. And then the last thing I'll show is how to send those bulk messages. So if you click on the left, you click bulk message send, and then select direct messages. We'll see this familiar bulk selector again. So I can either select multiple clients manually, or I can click that wrench icon and select any groups that are in my account. But when I have multiple clients selected and I send a message, it's going to go to each participant that I've selected as a private chat. They will not know it was a bulk message. They can respond, and it's a private message between you and them. So you kind of think of it as like a BCC, but if you have a treatment group get canceled and you want to notify everyone in the group, when you send a bulk message, it's not creating a group chat where we get all that chaos of like everyone seeing each other's responses. It is a private chat between you and each of the person that you send the message to. That is everything that I wanted to cover.
There's a lot. I see someone actually said they'd like to attend another one. If you are interested, if you feel like you didn't catch it all and you want to do it again, you can sign up on the registration link you used to sign up for this session, and there are more sessions throughout the week. Additionally, we will be posting these video recordings online, so you'll have an opportunity to review them there. And then I'm pretty confident that after Go Live, we'll have periodic webinars or opportunities or videos or training materials that we can bring to you to help you out as well. Are there any other questions outstanding from anyone before we end today?
So where online are you going to post this training?
So we will be sending links to the coordinators and everyone who registered. It'll probably be posted on OJD has a YouTube channel that you can only get to with the links. So we'll probably post it there. There also within Reconnect is a knowledge library that you have access to up in the corner, right-hand corner where your initials are. We will be building an Oregon-specific page there that Reconnect will host, and so we may probably put some links to some of these trainings or materials on there as well in the future. Yes, Matthew, I will make sure you are on that list. Well, if there's no additional questions, we appreciate you all attending today, and I hope you have a pleasant afternoon, Monday afternoon.
Thanks, everyone. Bye-bye.